Defense mechanisms, coping mechanisms, protective defenses, of the ego that attempt to protect the individual from feelings of inadequacy and worthlessness and prevent awareness of anxiety. When anxiety is too painful, the individual copes by using defense mechanisms to protect ego and decrease anxiety. Types of defense mechanisms. Compensation, putting forth extra effort to achieve in areas in which one has real or imagined deficiency. Conversion, the expression of emotional conflicts through physical symptoms. Denial, disowning consciously intolerable thoughts and impulses. Displacement, feelings toward one person are directed to another who is less threatening, thereby satisfying an impulse with a substitute object. Dissociation, blocking off of an anxiety-provoking event or period of time from conscious mind. Fantasy, gratification by imaginary achievements and wishful thinking. Fixation, never advancing to the next level of emotional development and organization, the persistence in later life of interests and behavior patterns appropriate to an earlier age. Identification, the unconscious attempt to change oneself to resemble an admired person. Insulation, withdrawing into passively and becoming inaccessible in order to avoid further threatening situations. Intellectualization, excessive reasoning to avoid feeling. Thinking is disconnected from feelings, and situations are dealt with at a cognitive level. Introjection, a type of identification in which our individual incorporates the traits or values of another into self. Isolation, response in which a person blocks feelings associated with an unpleasant experience. Projection, transferring one's internal feelings, thoughts, and unacceptable ideas and traits to someone else. Rationalization, an attempt to make unacceptable feelings and behavior acceptable by justifying the behavior. Reaction, formation, developing conscious attitudes and behaviors and acting out behaviors opposite to what one really feels. Regression, returning to an earlier development stage to express an impulse in order to deal with reality. Repression, an unconscious process in which the patient blocks undesirable and unacceptable thoughts from conscious expression. Sublimation, replacement of an unacceptable need, attitude, or emotion with one more socially acceptable. Substitution, the replacement of a valued unacceptable object with an object that is more acceptable to the ego. Suppression, conscious, deliberate forgetting of unacceptable or painful thoughts, ideas, and feelings. Symbolization, conscious use of idea or object to represent another actual event or object. Many times the meaning is not clear because the symbol may be representative of something unconscious. Undoing, engaging in behavior that is considered to be opposite of previous unacceptable behavior, thought or feeling.